Dr. Michael Nusbaum.
And I'm Dr. Daria Klachko, Totten.
And welcome to
HealthTalks.
HealthTalks. So what are we talking about today, Daria?
Well, I want to go over the pap smear.
Okay. Tell us.
Okay, so for those of us that have a cervix and a vagina, this is going to be an important and enlightening conversation.
All right, I'm ready.
I know most of you don't like going to the gynecologist. It's just not fun, and it's uncomfortable and sometimes embarrassing, but we got to do it. We got to do it to take care of ourselves, and the pap smear is an integral part of the GYN exam. So what is the pap smear? So I'm just, thinking that some of you might be wondering, like, when you go to the gynecologist, you get undressed, they have you move down, further down, and then they're all up in there with the speculum, kind of doing stuff, you're cramping, a little uncomfortable, like what exactly is going on? And as a board certified OBGYN, I can tell you exactly what's going on.
Please do.
So the pap smear is a screening test for cervical cancer, for precancerous and cancerous cells. Mm-hmm. And what happens is when the pap smear is done, the doctor inserts the speculum that opens up the vagina so the cervix can be visualized. The cervix is kind of round, like almost like a little nose at the end of the vagina. And what happens during the pap smear is the doctor takes some cells from, let's say this is the cervix, from the outside of the cervix.
Well, just by rubbing on it, you're not cutting anything.
No cutting,
okay.
No cutting. And then taking cells from inside the cervical canals.
Once again, just a swab.
Just a swab.
Right. Okay.
And sometimes it's kind of scary. They're coming at you with all these kind of instruments, but really it's, to your point, it's a brush that takes the cells from the outside the cervix, or a spatula looking instrument. Right. And then there's scraping. A soft, gentle scraping.
In a very sensitive area, but nonetheless, a scraping.
It's a scraping. Yeah. And then the cyto brush takes the cells from inside the cervix. So those cells all go to the pathologist who looks under the microscope at them to look for abnormal cells.
Okay.
In addition to the pap smear, your doctor, to the cytology, to take in the cells, your doctor might add on a HPV test.
Okay. So HPV is an infection, right? It's a sexually acquired infection. That can actually lead to cervical cancer, correct? It's been
look at Michael. Do you remember this from medical school?
I do. But there are only certain types of HPV that are related to cervical cancer,
yes,
right? Not all of them. There are a lot of different HPVs out there.
Yes.
What, 16, I think, is the
There's a bunch of different HPV. It's a human papillomavirus. So this virus, as Michael has said, is sexually transmitted, and it can be transmitted through intercourse, oral sex, anal sex, and just like contact skin to skin down below can transmit the virus. And unfortunately, it's a really, really popular virus. And there's, like you said, many different strains. Right. So some strains can, increase the risk of having warts, and those warts can be anywhere on your body, but there's certain different strains that can cause warts in the vulvar area, the anal area, and in vocal cords, in the mouth. And some of those strains can lead to cancer in those places as well. There's also strains that are stronger and more dangerous for the cervical cells as well. And that can lead to precancer or cancerous conditions.
I've actually read some articles that talked about HPV possibly being responsible for prostate cancer in men too. So it's not just women, it's also men. But please. How often do you need to get a pap smear?
So that's really specific to the individual.
Okay.
Generally, we start to do the pap smears around 21 years of age.
Okay.
And then add on the HPV testing at around 30.
Would you do it earlier if they're sexually active earlier?
Only if there's really a problem, okay, or if there's something you suspect that might be wrong. Let's say somebody has irregular bleeding that you can't really understand why, or some abnormal discharge that might be not related to an infection of the cervix. Okay. So there's all different reasons why you might do it earlier, but generally it's 21. Usually we stop around 65. And again, that's very specific to the individual and, their history, history, if they've had a history of abnormal PAPs or HPV in the past.
Okay.
So also, some people with low immunity, people on steroids or autoimmune disease, HIV infections.
Is that because they're more susceptible to the infection, or is there something else going on when they're immunosuppressed?
They're more susceptible to obtaining the virus,
Gotcha.
and also more susceptible to not being able to suppress it. Their immunity isn't strong enough to be able to suppress the virus. So if they have one of these more dangerous strains of HPV, that can increase their risk of developing precancer or cancer of the cervix.
Okay.
So the good news is that there's a test out there to check. So there's a test out there that can look to see, one, are you at higher risk to develop precancer or cancer of the cervix? And two, if you're developing abnormal cells, it can be caught earlier. So important for women's health to add this to part of your screening. So women can go, if they've had normal PAPs, sometimes 3 years, if they're having no problems, every 3 years to get the pap smear. But that doesn't mean that you should go every 3 years to the gynecologist, because the gynecologist looks for other things.
Sure.
And checks and does other preventative tests.
Well, gynecologist is the primary physician for a woman.
In many cases, yes. In many cases, yes. So be sure to get your screening done. Make sure you go for your preventative health visits with the gynecologist. I know it's uncomfortable. I know it's not fun, but it's really, really important. So make your appointment, go to your appointment, see your doctor, and talk about the things that you're worried about.
All right. So don't be scared of the pap smear. It's very important for good health.
Don't fear the pap smear.
All right, well, thank you so much. That was very enlightening.
Thank you.
Awesome. I'm Dr. Michael Nusbaum.
Dr. Daria, Klachko, Totten.
And thank you for joining us at
Health Talks.